You brush your teeth every day to make sure that your teeth and your smile are healthy and straight. So, what do you do to take care of your spine to make sure that your body is functioning well? I'm Dr. Loni McClellan from Illuminate Chiropractic, here to talk to you about the 6 degrees of spinal hygiene. That's right. So you know dental hygiene takes care of your teeth. Well, spinal hygiene will take care of your spine and nervous system. Today we'll look through 6 different moves. They're 10 seconds each. Altogether, that means 1 minute of movement. And if you do it twice a day, it'll make sure that you're functioning at your best. So let's jump in. Move number 1 is going to be looking a lot like when you reach down to touch your toes. We call this flexion of the spine. So as we are leaning forward, we'll make sure that our back is rounded, and these moves are all very gentle, no straining, no pushing, just leaning forward on this first move, and we'll take 10 seconds to stretch. So from the side, this looks simple enough as if going down to touch your toes. So leaning forward, you'll see a nice curve in my spine, and I let my head hang heavy. So 10 seconds here, we'll make sure that we get a nice flexion of the spine, bending forward, and as I come up, nice and slow, I'm stacking each of my vertebrae on top of the next. When I get to the top, doing the same with my neck and coming back to a neutral position. The second move is what we call extension. It's the opposite of flexion. So on this one, we're gently letting the head roll back. And again, no stretching or pulling, just a nice gentle movement, bringing the head back, getting a nice slight bend on the back as well as the neck. After 10 seconds in this direction, we'll slowly come back, and again, stacking each vertebra back on top of the next. You'll see that I didn't go too far. If I needed a chair or something, the wall to hold onto for balance, that's totally fine. This is more about getting some good movement into the spine, not so much about how far can you stretch back or forward. So those are the first 2 moves. Move number 3, we have side bending. We'll go to the left and right. So starting with one side, letting the head go over, and then you'll see that I go until I have a nice, easy stretch on the side. So you'll feel these muscles stretch on the side as well as on the side of the neck. Your whole spine should be, if you can imagine, in the shape of a candy cane, getting a nice stretch there. 10 seconds in that direction, then we come easily back to the center. Then you guessed it, we go the other direction. Now, letting the head tilt, getting that nice side stretch all the way through. Again, if you need something to put your hands on to balance, that's totally fine. It's all about getting a good movement through the spine in these different directions. Coming back to center after 10 seconds. This last move is called rotation. You want to imagine that your body is like a big corkscrew, all the way from our tailbone to the very tip of our head. So I like to put my hands in the center for this, and I rotate to the side. I'm looking up and over that shoulder. You can see I'm twisting all the way from my tailbone up through the head, big corkscrew, getting a nice, easy, gentle twist, coming back to center, and then after 10 seconds of that movement, going 10 seconds the opposite. So going from the tailbone all the way, looking up and over that shoulder, 10 seconds here, nice easy stretch. Make sure that each vertebra has some good movement, nice stretch on each segment. So that's it, all 6 movements, 10 seconds each. Make sure you're doing this in the morning and in the evening and staying hydrated, because this will all help your spine move, and the 6 degrees of spinal hygiene will make sure that you are functioning at your best for your spine and nervous system. Thanks for watching. We'll see you next time.